I think we are ready to go. All right. So welcome one and all to our first of many interviews here at Connected Health Quarterly. And now, for those of you who don't know, Connected Health Quarterly is all about striving to build a community of writers who are driven by the sheer joy of spreading the word of healthcare innovation and healthcare communication, especially in the country of our origin, which is India. And we have a panel of amazing authors that do some incredible work for us. For those of you who do not know and who are watching this on, say, YouTube or Facebook Live, we have our website, which is www.connectedhealth.com. So please check that out. But as I said, today is the first of our many interviews, and we're interviewing our authors. And to begin with, we are going to interview an author who actually specializes in communications herself. So we have with us live here Meghana Joshi. Meghana, do you want to say hi to those out there?
Hi everyone, and thanks Trevor and thanks CHQ for having me live here.
Wonderful. Okay. So Meghana is the lead for content at Avegen Health. But prior to that, Meghana has an MS in biomedical science. I've got my notes here ready with me. And that at the University of Buffalo in New York. And after that, she's had various roles, one of which has been a communications specialist at Meghana Health. And as I mentioned, her latest role is that of the lead of content in Avegen that's doing incredible work in the healthcare space. So let's, right off the bat, Meghana, let's talk a little bit about yourself. So do you want to tell us a little bit about yourself besides what I just shared with the viewers just now?
Okay, so yeah, as Trevor mentioned, I have a background in biomedical sciences, but I do have a flair for writing.
Okay.
Sure. So I have a very strong technical side, which is balanced with a very strong creative streak. So being in healthcare communications helps me marry both of these things, so I have, which I can articles and other material for the labor. So basically bring lay care from its pedestal of, really jargon heavy content to something that a layman will understand.
Excellent, excellent. So, and tell us a little bit about your work currently at Avegen Health, and also the work that you would have done at Mirai.
Currently, as a part of Avegen Health, I'm the content lead for the Together for Her Health program. And as part of Together's goal of reaching out to new mothers and mothers who have recently delivered, as well as mothers to be.
Okay.
I'm sorry, there's a bit of a lag, so I wasn't able to hear you very well. But in addition to what I do for Together for Her Health, we also handle some projects that deal with hardcore pharma and science research material and so on. But primarily, I generate content and curate content for the Together for Her Health program currently.
Excellent. Okay. By the way, just to let you know, Meghana, if in case are you hearing yourself right now? Is there a bit of reverb?
There is.
Ah, so that I figured that that was the reason why you was. So there, that just means that you can hear yourself on one of your windows. So if you want to mute that or shut that off, that must be that might be on. You might have yourself open on Facebook. Let me know. Let me know once you're good to go. Okay.
Yeah, one second.
Apologies for the technical issues, people. As I said, this is one of the first live sessions that we're doing, and live is always exciting and unpredictable.
Yeah. Yeah, we fixed that now. I can hear you well now.
Excellent. Okay, so so that's great to hear and to know in terms of your current work. So maybe shed a bit of light for some of our subscribers at CHQ and also the people at who follow us on Facebook and on other social media as to what is the importance of communication in the healthcare space today.
Communication in the healthcare space, it's well, to the layperson, it means chatting with their doctor about their health problems. Is my message getting across, or just picking up a wellness pamphlet in the reception area and browsing through it? It's much, much, much more than that. From somebody who has been in the field as well as behind the laptop, I know that putting the right message across and getting the right information, authentic, reliable information out to your audience is paramount. And it's paramount in pretty much every sector, but nowhere as crucial as healthcare, because reading the wrong information can send you down the wrong road, basically. So, what I want for anybody who consumes healthcare information on the internet is look for reliability,
Hmm.
look for authenticity. So that's really critical.
That actually makes so much sense because me personally, I can tell you that I'm a what my wife calls a web MD. I have any
Yeah.
issues, I just Google it and try and find solutions on my own. Um, so in terms of that seems to be a trend, obviously, where people um, just look at resources online and don't necessarily look at the authenticity or the reliability of the resource. What would you say? What would your advice be for people be a little bit beyond just looking for reliability?
Well, to use an analogy, you go to the grocery store and you pick something off the shelf. Somebody who's a little more discerning will read the label.
Yes.
So what I would suggest is for people to read the label. If you're looking for healthcare content, look for references. Look at how reliable they are. Do they come from a credible source? Was this article certified by a doctor? Things like that. So, or you just watch some video. Video especially is a tricky medium because there's a lot of health videos out there,
Mhm.
but there's no really regulatory body that looks at the tons of health videos that are posted on the internet
Okay.
and verifies them for authenticity. So it's a medium which has picked up a lot of momentum and popularity, but it's not really well regulated. So, just tread carefully and just don't buy everything you see on the internet.
No, of course, of course. So, and in terms of trends in the future, what are some of the things that you see happening? Because you did mention that video is now becoming more and more popular.
Yeah.
What are some other trends that you see looking to take place in the near future, especially in the healthcare space?
Okay. So I've been fortunate enough to be a part of some very innovative projects, and this is just the outset, but they do have the potential of becoming trends in the near future. Some of these have been very creative. For example, there's one program. It's part of the Maharashtra AIDS District AIDS Control Society.
Mhm.
that we've collaborated with, and it's about using something as routine and familiar as IVRS, Interactive Voice Response System.
Okay.
It's something that you typically associate with pesky customer service, but in this case, it has been used in a very creative manner to help HIV positive patients get reminders about their medication. It gives them a safe medium to enter their symptoms, to connect with healthcare information, to report whether they have taken their medication or not. So there are things that are happening out there which are being picked up. We also had experience with a voice messaging system through which mobile, through by means of mobile, message goes across to pregnant mothers in the low income sector. So usually the mobile penetration now is so high, so deep that pretty much everybody has at least one mobile phone in the family, in a country like India. We can use that as a medium to deliver crucial healthcare messages, involve the whole family in the care of a person in that family and things like that. So it has tremendous potential from a public health perspective. It also eases up some administrative concerns, and it really makes sense. So these are some very practical solutions which I hope will become trends in the future.
Wonderful, absolutely. And if we were to look specifically at India and communication within the healthcare space in India, what are some of the challenges that you've faced being a healthcare, being a communication specialist within India?
What is challenging about it is also, what's exciting about it, because we have so many languages in the country, and there are things that are in code. Like for example, if somebody says you're looking so healthy, it's code for you're looking fat. So things like that. So you have to really read between the lines, and you have to know the culture of a place to generate content that is culturally sensitive, culturally relevant, without losing its authenticity. You have to find ways of delivering your message to audiences that are, say, that's a nice part about Twin being a part of Almata, which is one of the divisions of Avgen, which deals exclusively with public health.
Mhm.
So you're dealing with low socioeconomic segments, and in that case, you have to tailor your messaging to such a level that your domestic health will understand it.
Right.
Uh, and we also do work as part of Desati, which is another division of Avgen, for which we write like really highly academic articles and things like that. So, which is all consumed within India, not just India, outside of India as well.
Okay.
But so these are the different things that really keep you on your toes, and it's like a right brain, left brain matching initiative sometimes. But like I said, what's challenging about it is also what's really exciting about it.
Wonderful, wonderful. I mean, I'm very excited as a communications person as well. I find it very exciting, and I find the use of technology and innovation incredibly exciting. And yeah, and the future is looks really bright if we play, if the country and if people like you and me play our cards right, right? Uh,
Exactly.
so you've been an author for CHQ, for Connected Health Quarterly, for a while now, ever since its inception. Tell us a little bit about some of the work, some of the articles that you've written for CHQ.
Okay. Um, there are some that kind of touch you personally. So I've worked with patients before as my role as a clinical study coordinator at the University of Michigan.
Mhm.
In that, you really get up close with patients, and they talk to you, they tell you their stories, you get a glimpse into their life. So which is beyond a clinical setting. So it helps you understand that what they go through on a day-to-day basis. So I worked with a project that dealt with chronically ill patients, and till then I had no exposure to what it means to have a chronic illness and how it impacts your life. So it kind of gave me a sensitivity. And then when people talk to me, like I had to write up something on behalf of a chronically depressed patient.
Mhm.
So it gave me an insight into what that person is really feeling, and I was able to bring it to my article.
That's a
So
really
that was
important.
one experience.
Yeah,
Yeah.
that's a really important point you've made, because we find at CHQ that the articles that actually get the most interest and get the most engagement are the ones that have a personal story to it. That's very relatable. and it's not necessarily purely academic. So so it's interesting that you said that that was one of the key, key learnings for you. If for other authors out there, and there are a few that want to contribute to CHQ, what advice would you give them in terms of how they go about structuring their content?
So as you said, I've been with CHQ from the early days. I find that it has evolved to some extent in terms of there were a few quite academic articles that came out initially, but over the years it has evolved into something that everybody would like to read. Especially again, like in a country like India, where people only start thinking about their health when they're either diagnosed with something, or they have a family member who's diagnosed with something, things like that. People typically in their 20s and early 30s are not bothered that much about their health
Mm.
yet. So for a publication like CHQ to bring that perspective to someone who's starting out in life, and so will live their life on a healthy foundation, sort of, so to speak. So I would like people who write for CHQ to approach it with that perspective, that literally there's no other publication like this in India.
Hmm.
There's no other publication with this extent of digital reach right now.
Yes,
So we do actually have a very powerful tool in our hands, and so anybody who writes for CHQ should keep that in mind and know that they are making an impact,
absolutely.
and yeah, use it as a medium to really create a more healthy country.
Yes. And what would you see, what do you believe would be the benefits of leveraging off of that? If we do, if CHQ does get authors that are tuned in as you've just described, and are able to generate content that spreads the message, how would that have an impact on the industry and maybe even on the country?
Could you repeat that, Trevor? I think I lost you for a
So,
little bit.
so I said how do you see that effective communication through CHQ impacting the healthcare industry?
CHQ has a wide audience, so it's not just who we reach out to digitally, but we also have physicians and experts on the panel who write for CHQ. So it's a dual pronged thing. So we're reaching out to the lay population as well as to the healthcare community, at large, the medical community. So they know what interests the people versus they know they have the expertise to share.
Mhm.
So it's just a movement that can build upon itself.
Yes, yes, absolutely. I like the word movement. I think I genuinely believe that this is a movement because, as you rightly said, we believe that there's nobody else in the industry or nobody else in the country that's doing what we're doing at. And we feel that there's so many important messages that need to be shared within healthcare. So what better platform, right? So for all of
Exactly.
you budding authors out there, make a note that this is a worthy cause, and if there's a message that you want to share within the healthcare space, whatever the specific niche or genre, please get in touch with us. Um, so yeah, so that's definitely important. Now let's go over to some questions and comments that we've received. So one question that we've got is, what's your mantra for healthcare communications? So you may have covered this already, but yeah, if you want to touch on that question that we've just received.
If there's one thing I feel has to be at the heart of every piece of healthcare communication, it is clarity.
Hmm.
Because any message relating to a disease or a behavior pattern or anything, has to be distilled from its medical definition to something that a layperson will understand, or something that a person who consumes that kind of content will understand. So whether you're writing for Nature, Science, New England Journal of Medicine, or whether you're writing for a platform like Together for Her or anything, so no, you have to know your audience, and you have to make your message clear for them.
Hmm.
So that is my mantra: know your audience and write for them
And
in a
right.
manner that they will understand clearly. It's as simple as that.
Wonderful. Very
And
succinct.
it's easier said than done.
It is.
Yeah.
I think,
It takes a lot of effort to make something simple.
of course, I think there was a quote. I think it was by Einstein saying, the best way you can show your understanding of a certain topic is by the simplest way that you can express it. So that's definitely a point. Another question that we've got here is, um, what have been some of your learnings as in your process of writing for CHQ?
Um, One is, know your research, do your
Yes.
research well, know your subject well, know the scope of your article
Hmm.
well, know your audience, and it doesn't hurt to put in a little bit of personal touch, because if you're an author, sometimes it comes out, it just comes out.
Okay.
So it's not an academic article, but you can maybe like insert a little bit of you in
Yes.
an article, which will engage your reader better and may help them connect to the article better.
Yes. Okay. That makes a lot of sense. The I've just got another comment here from Ravi. So Ravi asks, how do you allocate time to write? As a busy doctor, I find it hard, even though I genuinely want to share my thoughts and views.
Okay. Hi Ravi, and thanks for your question. May I ask what your specialty is?
I'll have to
Oh, you'll
say.
have to type it in. Okay. So I understand. So as part of Mirai Health, I've worked with doctors and I've seen up close how busy you are. So one thing that doctors can do is, look, you can actually collaborate with programs like Connected Health Quarterly. So, with a team that has the expertise and the insight into healthcare, and we, we're constantly looking for different topics that will interest the populace. So, whatever your specialty is, if there's a message that you have to put out, um, you
Okay, you
can
said
definitely collaborate with
my
platforms
wife
like
is a
these.
gynecologist.
Oh, definitely. Then, something like Together for Her, which deals with mothers to be and mothers, and the quality of care that a mother receives during childbirth. So it's a concentrated effort to improve the quality of care for mothers to be and in India. So you could maybe like keep up with programs like these and collaborate with them or be a part of them or follow them basically. And social media is another powerful tool. So all of these programs have their own social media presence. So it's something that can be collaborated upon as well.
Okay. Another one that we got earlier was, I have a lot of opinions and a lot of important points to share. However, I do not feel I'm a good writer.
Hmm.
So,
Okay.
how would we be able to help somebody like that?
Okay. Uh, so one thing would be that writing, especially if it doesn't come easily to you, gets better with practice. So it helps if you have something like a daily program, like you have a daily commitment to write one page. Start out that way, and you will find that it gets easier and easier to organize your thoughts. And just it also helps to have a journal for ideas. That really helps because something pops into your head and you make a mental note, and then next day you've totally forgotten what it was. So it's good to have like an idea collector, like a notepad or Evernote or something on hand, which keeps all your ideas in one place.
Mhm.
And you can set yourself daily targets to write, say 10 lines about something. And then you have to also find out which medium is best for it. Do you want it to be published on your blog or a newspaper or where basically? So find out avenues and
Well, ideally,
start, just basically
we
start
want them to write for
for
CHQ.
CHQ, yeah. So assuming that their ideas have to do with the healthcare mediums, but yes, write to us, CHQ.
Wonderful. Is that something that you do? Do you use Evernote and just collect your thoughts as in when you get them?
I extensively use Evernote, and I'm never without a notepad. So
Okay.
either I'll punch something into my phone or I'll make a note of it. But that's the most precious currency I feel. Ideas,
Yeah.
and the most rare. So if something happens to hit you, make a note of it. It may or may not pan out into something, but it's always good to make a note of it. You never know when it's useful.
Fantastic. All right. Well, I think that pretty much covers it, Meghna. Was there any parting thoughts that you wanted to share with? I think that we've got quite a few prospective authors that are watching us. Some of them are doctors, some of them are just professionals in the healthcare space, and I would assume that the reason that they're interested in this interview is because they themselves want to contribute, and share their thoughts, with others within the industry. So, any parting thoughts that you want to leave them with?
Yeah, the most uh, practical one would be, to write to us at CHQ if you have an idea for an article or if you would like to collaborate with us for an article. The other thing, if you feel yourself blocked, that you have ideas but you can't, really put them down on paper, we can maybe help you with straightening them out and fleshing them out into an article. So it usually takes like a phone interview or a phone call for it to develop. So it's definitely doable, and we are happy that you have thoughts and insights and expertise to share, and that you would like to share them with us and through us. So thank you very much.
Wonderful. All right. Well, Meghna, it's been a pleasure interviewing you and having this conversation. It's been very insightful for me as well. So yeah, thank you, and good luck with everything that you're doing at Avgen.
Thank you, Trevor.
Take
Thanks,
care.
everyone. Bye bye.